Well, there we are. We're live. Hello, everyone, and welcome to a conversation I've been wanting to have for some time now. A check in with Dr. Jeremy Faust. This week, we are at 100 days of Trump's first term, and we've covered so much of what Trump has been doing, but not enough about his assault on our healthcare system, on medical research, and on scientific research. And nobody has been doing as much fantastic original reporting on this, or few people have. It's Dr. Jeremy Faust, who is remarkable for all the things you do, Dr. Faust, including this work and all your reporting. Thank you for being here.
Great to be back. Good to see you.
Good to see you. Okay, for those of you who somehow don't already know his very impressive bio, I'm going to give you a little bit of detail. Dr. Faust is an emergency physician at Brigham and Women's Hospital. He's an assistant professor of emergency medicine at Harvard Medical School. He is also the editor in chief of MedPage Today, but most importantly, here, he authors the Substack called Inside Medicine. And he has been documenting from day one of the Trump administration all the things the administration, many of the things the administration has been doing in the health space. It'd be impossible to track them all. And importantly, this week has an exclusive first interview with the new FDA commissioner. Uh, and we'll discuss that with Dr. Faust in a minute. Today, we want to talk about the impact of the first 100 days and sort of what we see coming next. So, I got to ask you a first personal question. Like, we know each other too. We text sometimes and ask each other questions. This is really a lot of material. It's devastating stuff. And I'm wondering how you and your peers are doing and if you're feeling the impacts of any of these changes already.
My peers are certainly feeling this. I'm feeling it in a different kind of way because of my particular portfolio, what I spend my time doing, which is getting this stuff out there, researching, trying to shine light on that. So I have colleagues who are really hurting. I am hurting for them, and I'm worried about the state of, of affairs. But I would just say it feels like a pandemic. It feels like we are
Mm.
in a pandemic, except this time a vaccine is not a cure. This time it's just kindness, it's just caring, it's just saying, hey, we should retain our spot as the global leaders in science, research, medicine, progress. And that's frustrating. So I think that a lot of us are either directly affected by these cuts and these changes, and the rest of us are affected because we went into public health and medicine because we care about people and we want to make improvements, not flush it down the toilet in 100 days.
I remember in the earliest days of this administration, you and I were texting all the time. Sometimes he gives me health advice, but mostly we talk about the changes in his reporting. And I thought it'd be helpful just for to sort of go back and break this down. This was actually your clever idea. Let's talk about the very first onslaught in those first 10 days, and then break down what happened since then. Um, if we look at that first period, I remember when DOGE just took a, I don't even remember if it was DOGE yet, but the administration took a wrecking ball into some of these areas, starting with the WHO. We got out of that. What's been the impact of that?
We're still seeing this. And again, a lot of this is also projecting leadership. When Trump was brought these executive orders into the Oval Office, it was almost like this shot of a kid opening presents on Christmas. Ooh, here's a good one. Here's a fun one. Let's get out of the WHO. And I felt like I heard a million voices cry out in terror and were suddenly silenced. To quote Star Wars, like don't do that. Don't leave because they do good work. They need reform. But our ability, our scientists' ability to communicate is cut off by that. Our ability to get the best science and respond to outbreaks, 50 country surveillance groups that we're a part of, gone. So yeah, it was just it was a sad moment.
So that's the World Health Organization. Just one more minute. It means that the World Health Organization, they sort of tell us here's the formula for the flu shot you need
Right.
next year. We are now not getting that information as we speak.
Well, we're now getting. I will say that when I spoke to you before about this, that was my impression. Now it turns out they're saying, "Oh, well, we can still kind of get it," and so it's not ideal. And there's even a question as to whether our scientists participated. If they didn't, that's bad. If they did, and it was sort of secret, well, then why shouldn't we just admit that? Like, what is going on?
Okay. Another major change is that DOGE took the hammer to USAID, which people think of as sort of foreign aid, but it's actually a lot of health related aid. What has been the impact of cutting people off from that?
Yeah. So my colleague, Dr. Atul Gawande, who a lot of people will have recognized from the New Yorker, he's been a columnist there. He's a surgeon here at Brigham and Women's and at Harvard, and he was running the global health for USAID in the past administration. And I just feel for Atul constantly because he's documenting this part. Let me just get some numbers out for you because it's so important. Again, I mentioned USAID was part of funding a 50 nation consortium tracking things like bird flu. That funding is at 0% now. An AIDS program called PEPFAR, which keeps millions of people alive, prevents transmission from HIV positive mothers to fetuses, therefore saving lives of fetuses. That funding is basically zero. There is still some PEPFAR funding. Tuberculosis, the leading infectious disease killer on the planet for centuries now, is now basically cut by 50%, 56%. And then things like water and sanitation. So when we cut USAID and walked away from our leadership in global health, thousands of deaths just occur with a snap of a finger, and hundreds of thousands will come, and millions by the decade out. By the time we're out of this decade, because basically people at Doge, Elon Musk, and Donald Trump are angry about something, and they claim that they're rooting out abuse. But if that were the justification, they could have done the reform that they thought was necessary without literally taking the drugs out of the clinics where they are saving lives every day.
And we can't necessarily count on other countries to step in and backfill what we've vacated.
Well, we can't do that, and nor do we want to. I don't really think we want China to be getting credit for that work and doing our work. We set it up and we set the precedent. Do we really want them to be the moral leaders of the world? I don't. I think that a lot of things happen through soft power, and I'm not a political scientist, but I do understand this part, which is that when people make decisions, they make them based on the whole totality, and I think that it's a big mistake for us to walk away from this leadership.
In those earliest days as well, we also heard them canceling contracts, firing scientists. There was censorship, there were lawsuits. Um, it's a lot, but where does that stand? And are some of those contracts refunded? We heard about like cancer studies that got zeroed out.
Oh yeah. So we don't know. First of all, in those first 10 days, there were grant freezes, meaning money just stopped flowing. And then in about the next couple of weeks after that, we started to hear about grant terminations. And that is that the NIH, the National Institutes of Health, they give grants out to external researchers, and there is a line that says they can cut them for any reason. And it's not like it was for cause, like, oh, you didn't do a good job. They said, hey, you know what? We no longer believe in these issues. We don't think that looking at LGBTQ is important. And they didn't even give them a chance to say why it might be, even if you didn't agree with that, right? You could look at a study. I'll give one example of looking at transgenderism and Alzheimer's. Okay, you might not think that that's a priority of this administration, but actually, these kinds of studies teach us about Alzheimer's for everybody. And these researchers did not even get the chance to make that argument. So some of these are coming back, but it's really unclear. And honestly, lives are on the line and livelihoods. People are getting fired because this administration is a little bit gets the willies about things they don't understand, and I think that's not fair.
Well, I even heard of grants that were canceled because it used the word diversity, like diversity of species. And so anything with the word diversity because of
Mhm.
DEI is out, which is destructive, asinine, I mean, insane. Is that still the case? Or do we not
Well,
know?
we heard those kinds of stories because, and I wouldn't be surprised because, again, it was done so quickly that there's no way that someone could say, "Oh, we sat down and we looked at this." They made
Right.
all kinds of crazy mistakes, and I would just say that they cut things that really it's appalling because again, like I think personally, just personally, my belief is that when you look at things like diversity, equity, and inclusion in science and medicine, that has a benefit. But I don't necessarily think that everyone sees that benefit. But that's one argument you can have. But what's unarguable is that we know in this country there are literally differences between mortality based on your background, based on your race. And it's not genetic. It is absolutely a systemic thing. And so if we want to add life years, if we want to make life expectancy longer, it's not going to be from the next designer cancer drug. It's going to be giving people the best that we already have. And
Mhm.
a lot of studies on diversity were finding that. So it's like you want to save a million lives, great. Make sure that everyone gets their screenings, even if they're black, even if they're white, even if they're Hispanic.
You know, um, RFK, that HHS secretary, and we're going to move into that next, was on the daily, no, the Colbert, not the Colbert. What is it? One of those with John Oliver,
Mhm.
and he said Oliver is basically saying this is excessive. A lot of what you're doing, and he said yes, but we have to take advantage of the political capital when we have it. In other words, Trump has just come into office. This is the time they have the most power to enact change. And so what we're seeing are these extreme actions. And I say this for people watching who might say, well, how do you not know if these grants have been canceled? Why, if it's so bad, why aren't we hearing about this all the time? It's because so much has been ripped out so quickly that journalists don't have the capacity to cover all of it right away, and many of these things are small little folks in research labs out there who don't have access to the media or can't read. We don't see it all yet. Like the
Yeah.
toll is yet to be known in
And
some
even
cases.
the scientists, I can't remember if we discussed this, but even scientists weren't sure in those early days with the grant freezes because what happens is the NIH will fund a grant that a scientist will apply for, but the money actually goes to the university and then the university pays the scientist. That's how it works. And so if money stopped flowing, the scientists wouldn't necessarily know that because the university might just kind of make them whole temporarily while they sorted it out. And of course, the universities were afraid to speak. So we actually don't really even know.
Wow. It's crazy. Okay, somebody says this is what John Oliver talked about. So let's move on to the next 90 days. Like what we've covered so far was just the first 10 days. Sorry, sometimes I laugh because I don't
No, it's
know how to
crazy.
react, you know?
Oh, yeah.
Um, so I thought this was a clever idea. We're going to talk through this based on the HHS itself put out a list of its accomplishments from the first 100 days, and we're going to take that list of accomplishments and see what they really have accomplished. Dr. Faust is going to give us the real. So one thing they're touting is establishing a presidential commission to make America healthy again. What is this, and does it matter?
Yeah, so this is a slogan from RFK Jr., the Secretary of Health and Human Services, Robert Kennedy. That's a sentence that I'm still not used to. And what bothers me here is not the idea that we should look at chronic diseases. What bothers me here is that as if we haven't been saying this for years, as if the American Heart Association has not been saying diet and exercise for years, as if we haven't been trying to get lead out of water for decades. Like, I don't love this idea of them trying to take credit for this whilst they attack things like vaccines, whilst they take away HIV medications to, starving nations of the world. And so that's the problem, is it there's a little bit of like sloganeering happening.
Right, it's propaganda. Okay. One of the promises that's not propaganda, seemingly seems like it would be a real thing, is that the health secretary said that he is phasing out petroleum-based dyes from our food. But this is BS, right? He didn't actually get the companies to agree to do that.
Yeah, they made a big announcement, and then people who might have been involved in that decision, such as the companies, basically raised their hand and said, "We weren't even invited to any meeting. We have no idea what's happening." It's essentially they claimed victory on an idea that has not even been executed yet. And I will also just say, there's always this issue of of effect size. If this even goes through, as my friend Gideon Meyerowitz said, Fruit Loops will still be bad for you. It's
Right.
not going to like. The reason Fruit Loops are bad for you is
The dye.
not red dye. It is that it is full of all kinds of crap and sugar, and some of these chemicals are benign and some of them aren't. And there's this chemical phobia, and that's garbage too. That's an anti-science thing, but. Look, Fruit Loops aren't good for you. But yeah, so I think that there's this idea of like, oh, look at RFK protecting our kids from the dyes. But meanwhile, like we'll come to this later, the lead poisoning group at CDC was axed.
Right. And it's also important to underscore to people that this is a health secretary who is willing to stand up and effectively lie to you. In other words, he said that we are phasing out these dyes and that had not been agreed to. It would be like me coming on and saying, all movie tickets are free. I said it, doesn't make it true.
Right.
So you have to carry that skepticism with you when you listen to what he's promising and other topics too. Let's move on to an area that has been his hobby horse, RFK's hobby horse for a long time, which is the autism. Sorry, which is understanding autism, its causes, and he claims that it is uh, an epidemic he believes that's caused by knowable factors and changeable factors, and they're going to. They've announced a study that will tell us the cause of autism by a set date, And he has also used language about autism that's deeply wrong and hurtful to people who are on the autism spectrum. Can you talk about like what they're really doing here and what they can
Mhm.
do?
So first of all, notice the messaging and notice the response. Think about this. Whenever an issue is raised by a very prominent person, generally the stakeholders, the people who are affected by that issue, are very happy to get that attention and that limelight. They are like, yay, they're finally talking about our issues.
Right.
That is not the reaction that has happened from the autism community here. The autism community has been pretty united in saying, everything that we're hearing here is concerning. We do not want a patient registry, which they walked back. We do not want you blaming vaccines, which has been disproven over and over and over again. We don't want you characterizing autism as a disease that, as such, it is a spectrum of conditions. And the way he characterizes people with autism and on the autism spectrum has been really distressing to the autism community. And so they're not really appreciative of that. And again, the real thing of this idea of he said he was going to get to the root cause of autism by September. And I had two reactions to that. One, no, you won't. It's probably some weird combination of genetics and environmental stuff that we already probably are sitting on the answer in some way. But two, why September? If you think you already know the answer, which he probably does, you could know it tomorrow. And so I think it was like it's the imprimatur, it's the appearance of wanting to do science without doing that. And this is an area where the NIH director has been unfortunately not really. He's been sort of talking out of both sides of his mouth. On one hand, he said, "Well, give us more time. We'll sort this out in a year or two," which is also ridiculous. But on the other hand, he is really like not connecting with people on the issue that matters, which is that this is not a disease, and it's like it is things that people live with, and so there's been a lot of just mistrust that's been brewing here. So yeah, it's
And
not
just
great.
to be clear for people, when you said he already knows the answer, RFK claims that vaccines cause autism, despite the fact that science shows they do not.
That's right.
So when he
Oh yeah,
says
and
he
when I
knows,
was yeah, and
yeah,
when I was what I lost my train of thought for a second, but I mean what Jay Bhattacharya at NIH said was, and he said it more than once, I believe, which is that we've been afraid to ask as a scientific community about this question, and that's just patently untrue. No one's afraid to ask this question.
one quick thing. You had said there, I forgot about this. He had said that there would be a registry where they were going to track people who have autism by not just asking them to participate in a study, but forcefully gathering data from their what do you call them, smart devices about their
Mhm.
health, getting data from like pharmacies about pharmacy and
Mhm.
hospitals. So it's like a weird big brother scenario of creating a database of people who have this condition that's now gone.
Yeah, they're walking that back. And I just want to say that with all of these things, there's always some degree of nuance, which is that, look, we do use big data to go through and track things like disease prevalence. And that can be anonymized data from lots of different records. They can be from claims data for people who are getting care. They can be from Medicare, Medicaid, or other or industry. It's okay to do registries and to look at prevalence. What was really concerning the community was the way in which they were discussing it, which was had real privacy concerns, and they've walked it back.
Okay. Let's move on to the big thing, which is Doge. HHS says that Doge saved more than $67 billion there, which I just say that's questionable, period. There's research to suggest that overall Doge has cost more. So Trump spent more in the first 100 days than prior administrations. But let's talk about what they've changed and break it down by area. First, the CDC. It's like a big topic, but can you kind of encapsulate for us what has Doge done to the CDC?
Yeah, Doge has really gone in and oh, go ahead.
Explain for folks what the CDC does first, in case they aren't sure what they are.
Yeah, so it's the Centers for Disease Control and Prevention, mainly in Atlanta, but there's also a DC, and then there's other satellites. And it's basically our largest public health agency looking at epidemiology, public health education. The CDC does everything from tracking flu and COVID to making annual recommendations on vaccines to making other like investigations that normally there'd be a more robust team deployed for outbreaks for measles than there is. They would look into if there was a bunch of kids getting sick, what's causing that? Is it lead? Is it a salmonella thing? So they do a lot of public health on the ground work. They develop policy, and they also have boots on the ground.
Okay. And what have they done to them?
I mean, attempted to destroy it without destroying it. USAID is effectively destroyed. The CDC is not. It's been reduced by several thousand of their employees, and lots of cuts are coming. Um, just to recap some things that have happened, they took down. First of all, this was in the first 10 days. They censored the CDC. They said the CDC can't even talk about certain issues anymore because, again, this administration is very oddly kind of sensitive. It's a little weird to me, like how worried they are. If oh my gosh, what if we talk about the fact that people, have different sexual orientations, or if they, or what if we talk about the fact that, like, if you're a young person of color, access to healthcare is not as easy, and so we want to work on that. And so they censored all this stuff, and then a group of plaintiffs sued. They won. A lot of that stuff's been put back on, but now we're seeing in the kind of next phase the sort of legal approach to this, which is that they're now going, DOGE just did everything by executive order and by emails. And it was just horrifying to see how much actually worked. Some of this was reversed. People were fired, they came back, programs are, sort of on the edge. But now, and I published this in Inside Medicine a couple of weeks ago, um, there's a proposed budget from the president that's going to go after Congress that says here are the cuts we're going to make to HHS, including CDC. And it really boils down to, I'm just going to get the number here. It really boils down to $121 billion for HHS going down to 80 billion. So that's huge, right? By a third. And so at the CDC, it's from 9 billion a year to 5 billion a year. That is stuff that matters. And they're bragging on their website things like, oh, we're getting rid of these useless COVID grants. You know what? There's something about that. On one hand, these COVID grants that are still out there, they are actually funding Boston, New York, San Francisco, Dallas, all the local health officials are getting that COVID money, and they're, quite frankly, they're using it in lots of different ways for COVID, for disease preparation, for outbreak preparation. And so when they brag about cutting that, what they're really saying is we're cutting your local jurisdiction's ability to respond to not just COVID, but flu, RSV, another pandemic. So they're bragging about it. And it's like, I always joke that half the time when they make an accusation, it's confession. On this website that we're going through, where they're touting their first 100 days accomplishments, a lot of it's bragging about these confessions. They are cutting your safety. And so that's really bad. They cut, and this in this budget proposal, they're cutting things like Head Start. They're cutting things like the disability centers that keep, like, group homes where people with intellectual disabilities can live and get care. They're cutting oversight to that, so that there could be abuses. They are cutting what else? Oh, the injury centers. We know how many people are dying of opioids, gun violence, all gone if this goes through Congress, and it would be legal if Congress votes on it.
So, first of all, they're doing this to fund tax cuts to major corporations and the wealthiest Americans, is just the reality. That's not a political statement. That's true. No administration has ever done anything like this. I want to go on to other areas, but I don't understand how we live then. I mean, I have this vision of, they're also talking about cutting Medicaid, which we can get to, but people lined up outside ERs for days and, you know, like chaos.
Yeah, what's annoying about it, and that's not even the right word. What's tragic about it is that I liken it to road work. If you if you cancel all the road work, you feel great the first day because you just saved money, and there's no potholes yet. And then over time, some potholes happen, and then people, they slow down, and then sinkholes happen, and their cars, they flip and they die. And so what I worry here is that most people don't know that we are the proverbial sort of, frogs boiling in the water, the whatever, the lobsters. Like, we don't feel the heat until it's too late, and then at that point they'll blame somebody else because someone else will be in power.
Well, also, these are very hard systems to stand up. It's taken decades. It's not
Yeah.
like you can just rebuild it right away. I I mean, are you deeply concerned about utter chaos and medical crisis in parts of America?
I worry about care. Yeah, I worry about care access. There is already a huge differential in this country. Some have it, some do not, and I worry about some of the other effects that are coming out of this, like vaccine programs. Look, if they stop pushing the idea that science matters, if they stop promoting vaccines, you'll have decreased vaccine coverage. I will tell you right now, like I've got a paper that's pre-printed. It's not published in a journal yet. We looked at vaccine rates by political election outcome. It's political. Like the red states have lower vaccine rates in
Right.
kids. And what's going to happen is that's going to spread and you're going to have a less healthy population. So, and by the way, when you get some of these viruses, they do cause long-term problems. So, if you want to talk about fighting chronic disease, a great way to fight chronic disease is to fight acute disease and the infectious diseases. So, I worry greatly.
And PS, that'll cost all of us more. It just means the blue states will be funding the red states where they're not getting vaccines. So, because we have to pay
Yeah.
more for their emergency care when they get measles or whatever.
Correct. And again, like to your, we can get to the cuts, but yeah, I mean, it's one of these things where the less we do medically in terms of like when I'm an ER doctor, the least expensive thing in the world is you don't need any care.
Preventative.
Great.
Yeah.
Great. Preventative, great. Go home, you're fine, reassurance. What's expensive is putting kids on ventilators. What's expensive is shocking people out of, arrhythmias that they don't need to have. That's expensive.
Okay. So you talked about cuts at the NIH. I have some specific questions, but give me a general sense. Like we kind of covered that. Some of them have been reinstated, but
Mhm.
aren't there people who are sort of cancer researchers out there whose studies have been shut down?
Yeah, so let me just first kind of start with the NIH, the National Institutes of Health, based in
Yes.
Bethesda, Maryland. It's really broken down into two main activities: intramural research, that is, they attract the best and the brightest that they possibly can to go do research on that campus and to do great work, stuff that the private sector would never do because there's no kind of profit margin for it, rare diseases, and quite frankly, Hail Marys, things that are a little bit like a little bit of a risk. And they should do more of that. We've gotten away from that. That's how Tony Fauci got started. He went there and he ran a lab. And Francis Collins, who ran the Genome Project, he ended his career there doing that work. Then there's the extramural research. That is, the NIH funds people at universities, institutions to do research, and some of that research is pairing with pharma, with industry. That's okay, and that's how they work. So I'll just give you the numbers here. The NIH budget is 47 billion in 24. It'll be 27 billion. It'll be cut by 20 billion if the budget that is proposed goes through. Let me just put this into one other piece of perspective for you. There have been about 229 Nobel Prizes in physiology and medicine given out since 1900. 44% of them were done by people born or immigrated to the United States of America. We are the undisputed global leader in innovation in science. We fixed problems. Acute lymphocytic leukemia was a universally fatal disease in children in my parents' lifetime, like in the 50s and 60s. And today, many forms of ALL have a 95% cure rate. And that is because of research that has been done by us. We should be proud of this. And the idea that we know which ones are going to work out is insane. It's a venture capital. You fund things, and sometimes things don't work. Sometimes things do work, and sometimes things unexpected happen, and you lead to a breakthrough. So that's what's at stake.
One of the big research projects that was unfunded was the biggest investment in women's health research to date. And that matters because, for folks who aren't aware, until lately, most medical research, the majority, is done on the male body and then it's applied to the female body, but that obviously doesn't hold. And so, this was an opportunity to address that
Right.
and study women's health. Uh, Maria Shriver got, this is her area, and she got public about it and put pressure on her cousin RFK, who I think has now I don't, where does this stand?
Yeah, the best that I know is that that's correct. And first of all,
He
it should
walked
give
it
us,
back.
well, yes, it's been walked back maybe. So first of all, it should give us pause that major functions of our research infrastructure should be determinate upon nepotism. That we should not accept this. And this is not my idea. This is an idea that one of my colleagues, Jen Gunter, pointed out. And it's absolutely correct. We shouldn't be waiting for Maria Shriver to DM her cousin. Okay, that's just not appropriate. but that's where we are. We'll take the win. The reality is that the Women's Health Initiative had basically been told weeks in advance, this is your funding is going to vanish. So we know it wasn't one of these oopsies, the wrong person sent the email or something, which has happened during this administration. It was planned. And then it came out, and then all this news cycle happened. And last I checked on their website, they said, we've heard the news too. We haven't heard any official communication on this. So they're in limbo. That's where we're at.
Last thing on this, let's just say hypothetically, Democrats win Congress in the midterms, both houses, and they can pass new legislation and refund a bunch of this stuff. Can these studies be started up again, or do you have to start from scratch?
Well, some of them yes, some of them no. And one of the things that I think that everybody should agree on is that we shouldn't waste taxpayer dollars. And that one of the things that's happened with some of these grants being frozen and some of them being terminated in the middle of them is that the administration is saying, we don't even want you to finish. And that's so insane to me because think about it. That's all investment without return on investment yet. At least finish the thing, right? Learn what you can learn. Or if you really want to be a jerk and kind of draconian, you could say, we don't love this, but could you tweak it so you could study something else a little bit different? Like find a way to work with people. But the way they did it was so harmful both to the science, the scientists, and also the culture. And then starting look, clinical trials. When you cannot stop a clinical trial in the middle, and yes, clinical trials are being canceled. Now you lose patients who have been randomized to placebo versus medicine. We don't know if it's going to work. So yeah, I think that's a big one. But another big one is brain drain. I mentioned before that 44% of our medicine Nobels of the world have come from this country, and I think a third of those are from immigrants, if I recall. And so that's a whole different. It's not my beat, but like, hello, brain drain has really benefited science and health. Um, People, it was either Nature or Science, I think it was Nature, did a sort of an unscientific poll where they asked their readers, if you're a scientist, are you considering going elsewhere? And 75% of respondents said, yeah, I consider bolting. So
Yeah.
even if we want to get this back up and running, we're going to have to promise everybody that this won't happen again.
That's- Okay. Grim. Let's move on to the FDA, and this is a big one. You got the first interview with the new FDA commissioner, Martin McCary. Is that how I say his name?
Yep.
He can't really decide if they want to approve or recommend vaccines. Many of them. What did you learn from your conversation with him?
Yeah, I learned a lot of things, and I think we got some more questions. So I've known Marty for some time, and we really have I think a very good understanding between the two of us that we try to come together where we agree, and there are some things we'll discuss where we don't, and then there's some things that are so far in disagreement that we just don't touch it. And maybe that'll change in the future, and I'm there for that too. But what happened was I was writing a story for Inside Medicine, basically in which I had a handful of former FDA people and then a bunch of insiders who didn't want to be named, but I know who they are and all that kind of thing, saying, look, things are not good here. The reductions in force really have affected us. And they were saying that the narrative that the administration had put out there, which is, oh, it's just getting rid of bloat. We didn't get rid of scientists. The FDA can still do its job. They, on the inside, were saying that's just not accurate because both on the merits, some scientists and researchers have left, some from these reductions, and some because they see the writing on the wall and they're like leaving in droves. And then also, these administrative people do work. They actually help get contracts. They make it so that things can actually happen. And so they're screaming to me like, "Help! Help! Help! Please tell our leadership that things aren't great." And so I went to Dr. McCary and I said, "Look, I'm going to write this piece, and I think it would be really good if you responded to some of this stuff." And we were having a conversation, and I said, "Look, this is really great stuff. I don't necessarily agree with everything you're saying, but you should get this on the record." And he said, "Sure, let's do it." And so we went back and forth, and we put together this interview. And I think we learned a lot. He certainly doesn't. I think, first of all, in the interview, I think is the first time he really did acknowledge that things aren't great there, just morale wise, and that he inherited that. That's true. He was not the one who did the riffs. It was before, and that there have been things where, look, they want to get some people back in who they lost, and they want to correct things. So I think it was good for him to get out there and say that stuff.
Okay. And
there's more particulars. I don't know if you want to get
well,
in
I'm
there.
sort of curious to know some of the specific things. Like the FDA has suspended milk pathogen testing.
Hmm.
There's concerns about H1N1 right now. Like, did he talk about like what WTF? What are we supposed to do about that?
Yeah, this is a great example, and this is like where I think it's a perfect question for Jessica Yellen to ask because there are some of these things where the headline is like, oh, and then you look under the hood and it's like, not so bad.
Really?
So the Washington Post reported on this, and they actually quoted an external person who, as far as I know, is not some kind of shill, who was saying, look, this is kind of a redundant system. Like for the most part, there are other ways we're testing milk. Like this was kind of going to be phased out anyway. But the thing is, it doesn't look great in these moments. And let's talk about vaccines too for a second. Where sometimes when they make policy that actually under the hood, if you looked, is reasonable, the problem is it's in a landscape of unreasonableness, and so you have to take everything not at face value and worry
Right.
like what's really happening. So that's sort of that's an own goal. They're sort of they're kicking their own feet.
And from my personal safety, everybody's personal health safety, we shouldn't have to don't worry about the milk.
I mean, I don't recommend raw milk, right? That's not a thing you should. There's no benefit there.
But the
And
fact that they're canceling this testing is not we're not all going to die.
that particular
Okay.
part is not a problem. What's a much bigger problem is that this HHS and this government is generally getting behind on testing animals for H5N1 bird flu and for increasing our ability to respond to a pandemic. I think that's where the real issue is.
And they're talking about maybe not approving a COVID vaccine for next year. Is that a problem? That seems like a problem.
This is a real interesting one. It's an area where we can get into some nuance. And so, first of all, there's the Novavax vaccine itself, whether that should be fully approved. That's like one topic because there are three main COVID vaccines that we've been using: the Pfizer, Moderna, and those are the mRNA vaccines. For adults, those have full FDA approval. The Novavax one is a more traditional platform for vaccines, which is why people liked it. And that does not yet have full approval. So that's whether that should be approved is a big area, and I think we should talk about that because it's super fascinating and important. Then there's the question of the vaccines that are out there, what are we recommending for people to do? And that's a different topic, and we should touch on probably both.
Okay, can I just ask you about a couple other things because yeah, okay, why don't you
Yeah.
tell me headliney what you think we need to know about those two things.
Yeah. I mean, I think the big thing on the Novavax one
Okay.
is that people are watching this as a bellwether for the FDA's independence. Like, are they going to not approve this vaccine because RFK has said bad things about it? And
I
I
see.
think if they do not, they are going to lose an incredible amount of credibility. Now, when I talked to Commissioner McCary about this, he convinced me that the issue is not with his boss, it's not with Kennedy, that he has issues, and his issues are purely theoretically are not necessarily incorrect ones. He was saying he'd like to see a new study that would maybe increase uptake. By the way, he said maybe a new study would increase interest, and I said, okay, that's a nice thing to say. That's a pro-vaccine statement. I don't think that Marty is like a closeted anti-vaxxer, but I think that there you could approve it and still say let's do that study.
Right.
So there, he has issues on the science, and the real issue that people are watching is how can the FDA change its standards at the last minute, and that's what you cannot do. You can't just like say, "Oh, just kidding, we're changing our standards." So that's that issue that we're watching.
Should we be going out and getting as many vaccines as we can now? Like, is this stuff going to go away, and so we should go get the pneumonia vaccine now and the COVID vaccine now? And
Uh, I don't know. I think that every single person has a different uh, place they are in their vaccinations. I think a lot about like a big question is should we move the measles, mumps, and rubella series earlier because now prevalence is going to be higher, and so babies who are not yet old enough to get the vaccine are at high risk. And there's real discussion about whether we should push that recommendation to sooner in life to 6 months, and I think that's something we need to look at. The rest of us, I don't think I have an answer for that.
okay,
Briefly on the what are they going to do with the fall vaccines and all this, this is something that's happening at the CDC. And to the best of my read, this is not a political thing per se. This is not RFK and a hostile administration. But again, in the context of an HHS led by a guy who says that vaccines have harmed people, it's
It is.
totally reasonable that people might have that impression. And I think that what they're going to move towards is recommending COVID vaccines for high risk people. And what I hope they do for everyone else is to say that they may receive them. What would be bad is if they took that option away without really justifying that, because you really need to show a really compelling reason to do that.
Okay, I'm going to just bring up a couple of other things. And then one is that the FDA is planning to limit the amount. Oh, the USDA is halting plans to limit the amount of salmonella allowed in poultry. The EPA has canceled grants tracking toxic chemicals affecting children. They might also roll back limits on PFAS in the drinking water. This, on top of the fact that in some areas, fluoride is being taken out of the drinking water. A bill just passed in Florida to that effect. We're like going in reverse on some of the known factors that undermine our health at the same time that there are possible cuts to our access to healthcare. What do we do?
Well, first is we acknowledge that that is what is happening, which is again, you have defunding of EPA scientists and even young researchers who do this work are getting defunded to find out where kids are at risk, right? Lead poisoning, other things. Why would you ever do that? Well, the answer is they're trying to cut science left and right because they don't believe in big government. But then on the other side of out of the other side of their mouth, they're talking about, oh, we want to get rid of toxins like dyes, and it's bizarre to me. It tells me that they're not serious. It tells me that they're going too fast to be considered serious. And so I think that we are going to see pushback. We're going to see, and hopefully before we see these outcomes. Now when it comes to things like how much salmonella should be out there, I would say there should be zero. But I'm not a food scientist, and there's certain acceptable risks about what levels we track at. On the fluoride piece, again, I think the research has been completely mischaracterized. There are papers that show that at really high doses, fluoride cause a problem. That's true of salt. That's true of water. You can die of water poisoning. The dose makes the poison, and so this notion that fluoride in the recommended levels in the United States is a problem is baked. It's wrong. It's incorrect. So we want to make sure we're away from any toxic dose, but there's no evidence that we're doing that. So they pick these hobby horses and claim victory, and meanwhile they're cutting science that actually undermines the health of our communities.
I mean, as somebody who does political reporting and looks at the overall picture of what they're cutting and what they're funding, I would say that I so respect your journalism. And it's probably, yes, the case that inside these agencies, they have to make these difficult choices about what to cut. Big picture, this administration is not about smaller government. They are increasing funding for the Pentagon. They have no problem funding a new sovereign wealth fund or a crypto fund or giving Elon Musk certain government subsidies and access to new grants and programs. It's about what they prioritize, where they want to spend the money. And fundamentally, it just seems, as a person observing what's happening, that they are pulling the rug out on the well-being of regular Americans who rely on our government to have a public safety function, and just putting money elsewhere. So I just that's my own perspective on this. You don't have to agree.
Yeah.
Uh, I just I'm a s- I don't I it's sort of gobsmacking to me because at some point it becomes everyone's problem if a portion of the society is terribly ill and can't get health care. So okay, let me just ask you about that. One of the theses, one of the government is looking at big picture now, possibly making cuts to Medicaid. Um, the president wants to pass this budget and tax cut bill. It has a lot of lost revenue because there's these major tax cuts in it. Because of how Congress works, they have to pay for a lot of that. And the Congressional Budget Office has said the only logical place to find the pay for is by cutting Medicaid. Huge, massive cuts. Would you tell us a little bit about what Medicaid does, who it takes care of, and what happens if that goes away?
Yeah, Medicaid is the federal government's program, but it is run by states that provides health care to people who are disabled, people who are poor, and it is it was expanded drastically and massively and importantly by the Affordable Care Act. And it has brought healthcare to lots and lots of people. And it saved a lot of lives. And during the pandemic, it even was loosened in terms of who could get it. So that was really, really important. One of the things that I think people don't realize is that there's a difference between, cutting back on a service or two and the whole thing disappearing. And I the budget as I've seen it could cause the second one to happen. People could just lose their health care. And the reason is that under the Affordable Care Act, the federal government subsidizes the states to carry this work out. And they subsidize it at a very high level, like 90% or higher, like a 1 to 1. And so if the government says, well, we'll just change it so that we're only matching, instead of every dollar we add a dollar, it'll be for every dollar we add 80 cents. So it sounds like a 20% cut. But a whole lot of states have a rule that says if the federal matching drops below 90%, we're cutting the whole thing. And so then millions of people will lose their healthcare overnight. And this will be young people, people of color. I mean, some crazy high number of pregnant women in this country are covered by Medicaid alone. So this would be so unpopular. I think that Congress has to figure out what to do about it. What I suppose what they'll probably do is one of the two things. They will either push back and it will be defeated. That would be great. Or they will accept it, but they will pack all of the cuts into years 7, 8, 9, and 10. And so no one will really feel it. And they can claim they saved the money and nobody will be pissed off because they'll keep going to their doctor and they'll still have insurance. And then they'll kick the can down the road, or maybe they won't, and a hostile Congress will just say, forget it. So I think what's on the line here is the care for millions and millions of Americans.
It's just wild. It's wild. There's a whole bunch of stuff we didn't get to. Is there anything I want to keep it under an hour because when it's an hour, people sometimes don't click to watch. So, is there anything you think we must talk about before I ask you my last question?
No, I think you've been getting everything that I want to get. Well, let me no, I yes, there is something I want to say, and
I
that
knew it.
is that if you want to save taxpayer dollars, you don't go after HHS, which has 80,000 employees. You make a couple fewer nuclear warheads, okay? You redeploy people. There's this idea that people at HHS, at CDC, FDA, NIH, Indian Health Services, that these are a bunch of bureaucrats who like punch in and punch out and don't care. And let me tell you something. I know these people very well. They are mission driven. They are insanely committed to what they do. It's so great. And so the idea that we should be firing 20% of them, which is what's happened, and that that's going to help the American people is incorrect. It's not only is it cynical, it's incorrect thinking. You could hire someone to say, hey, could we redeploy some of these people to different things? Could we align some of these things? And so that instead of having some duplicative stuff, we could free these folks up and figure out what they're good at. That would be really, really good progress. It's happened before. Look, President Clinton made some cuts and they were deep, but it was well thought out. And I think that it was seen as relatively successful. So my message, what I want to say you should be covering is that the federal government has employees who have been keeping us safe. We're going to miss them.
Hmm. Oh, it's so brutal to hear you say that. And it reminds me to just tell anybody who's in the healthcare space, all of the frontline workers who follow you and follow me, thank you for your work. For the researchers and doctors and nurses and everybody in this space, there's so many who's it's I know how hard it is now because it's not just the difficulty of your work, but the pressure and the rage you must feel at the system for disrespecting you. Please, it's not all of us. We do see you and we honor what you do.
Yeah, and I think that they do, and they appreciate hearing that. I think that when people show up at these demonstrations to support them, it heartens them. It keeps them going. The ones who are still there, they want to fight, and they all have a line they won't cross. They won't do certain things if asked, but they're hoping to fight and stay and work for us.
And this is why people need to still keep calling your members of Congress and still keep showing up, whatever your party affiliation. This is not a partisan issue, it's our health. So, on that note, my last question for you, and this might be hard to answer, is Is there anything we can do to keep ourselves healthy and safe now in preparation for what might be coming?
Hmm. Well, the first thing is what you just said, and it sounds so cliche, but it is important, which is to call those reps and to call the senators and to write emails and to just be loud. Because the first 10 or 20 days of this administration really was a bunch of executive actions and a bunch of DOGE operatives just seeing what would stick and what would break and what they could do. And this next phase, the big reorganization at HHS, which is this $40 billion cut, right? That is going through the regular budget process. They're asking Congress to do this. And the House will probably sign off on it, but the Senate probably will not. And then the question is what will happen and what negotiations. So this is a moment where actually it matters that they hear from us because um, this is the legal campaign by the administration to do the kind of damage that they've been trying to do in the first few weeks.
I wish I had a more uplifting note to like let us end on, but I
I can
can't.
I can give you something.
Okay,
I,
good. Go,
um,
please.
how about this? Opioid deaths are finally coming down in this country. We don't exactly know why. There could be some reasons that are kind of sad to think about, which is that the highest risk have already succumbed. But we also know that things like naloxone, Narcan, access to care, these things work, and so worth fighting for. Look, we have a win. That's happening. Let's not cut that work, which is being floated. Other things, I don't know. We finally, in the past 10, 20 years, we're doing some really important firearm safety research, and we see that in the states that have better firearm regulations and firearm safety, there's less mortality there. So let's not cut that. We can do better. So I think that my message is that we actually have a system that has given us results that we can be proud of, and that's worth fighting for.
I have one other good news thing, which is the work you're doing. And you are exceptional because you're in the ER doing the work. And let me tell you, folks, he texts me, we text sometimes and I look up and I'm in Los Angeles. It's like 2 a.m. his time. And he's doing the work in the emergency room. You're doing the work of reporting and research. And you are this remarkable combination of data whiz, wise medical voice, and just a huge heart of gold. So thank you for showing that you can be all those things and for the work you're doing.
Well, thank you. I am a huge News Not Noise fan and consumer of all of that because I also need to be talked down.
I'll
There
let
are
you-
times when I worry, and your level-headed reporting and approach is a comfort to me and also a lot of my readers as well.
Thank you. So, to everybody who isn't already following Inside Medicine, please do sign up for Inside Medicine. It's his newsletter, and let's do this again in a little bit to just catch up on where we are in a few weeks.
Sounds good. Thanks for taking all this time to do this.
Thank you, and I hope you don't have to work all night. I'll see you. Maybe. Okay. I'll see you soon.
Bye.
Bye. There we go. He is amazing, isn't he? I am such a fan of his, and I would urge you to check out Inside Medicine. The difficulty of all this is, I started this saying that I was going to do news, not noise, to give you information, not a panic attack, and a lot of this is panic inducing. But I do believe, and it's backed up by my reporting, that we're not just in sort of this political time of political strangeness, we're in an information war. And part of what is going on is some people don't have full information or facts about what's happening. So it is important for all of us to be aware of the information Dr. Faust is sharing and for you to share trusted information with your circle so that they can do the same thing. And I know it's hard to pay attention to so much difficult material all the time, but it is part of the work of defending our system and our democracy and our healthcare. And so, my guess is after listening to that, you feel fired up to call your members of Congress. And if you can help others do the same, that's how we make change. So, we're all soldiers in this information war. Let's do our part. And One other note, I am doing a conversation with Van Jones on Friday. That had originally been scheduled earlier in the week, and we had to reschedule it. So that's going to be on Friday morning, I think at 11 a.m. Pacific. I'll send that out. And I'm going to be in Denver at the end of the week. So for folks who are in Denver and want to meet up, you can email us at our community at News Not Noise email and get the details of our meetup. And I think I have covered all our bases for today. So that's it for me, and I'll see y'all soon. Bye. Sign up for Inside Medicine.